San Francisco researchers have found an effective way to help homeless residents suffering from mild to moderate cases of COVID-19, house them in hotel rooms, thus lowering the burden on hospitals deluged with more seriously ill patients. The findings, published Tuesday in JAMA Network Open, underscore the public health benefits of providing stable housing and services to those who need them most. "What they did makes absolute sense to me," said Dr. Miriam Komaromy, an internist who specializes in addiction medicine at Boston Medical Center. "I think it's what needs to happen in communities around the country. One of the first things anyone exposed to or infected with the coronavirus needs to do is quarantine or isolate, that is, hole up at home and avoid other people for several days to prevent further spread of the virus. That's not an option for the more than 500,000 homeless people in the U.S., who don't have independent and reliable shelter. Nor is it feasible for those living in marginal housing, where people may live in crowded quarters or with shared facilities, often due to high housing prices. Both groups run a higher risk of being infected and of transmitting the virus to others. And spending time in a homeless shelter comes with its own perils, since many have become COVID-19 hotspots." This was a major concern for public health officials in San Francisco, where 8,000 people experience homelessness on a nightly basis, and 18,000 low-income people live in single-room occupancy hotels with shared kitchens and bathrooms. Even in the pandemic's early days, there was clearly a need to set up alternative housing to stop the spread of SARS-CoV-2, said the study's lead author, Dr. Jonathan Fuchs, a physician-epidemiologist with the San Francisco Department of Public Health and UC San Francisco. The researchers acted fast. On March 19, 3 days after San Francisco declared one of the country's first shelter-in-place health orders, the team began welcoming patients as guests into the first of 5 isolation and quarantine hotels. For their report, the researchers evaluated the program from March 19 to May 31. Of the 1,009 guests checked into hotel rooms for isolation and quarantine, 501 were either sheltered or unsheltered homeless people, the rest were marginally housed people living in overcrowded or otherwise risky conditions. Overall, 463 were diagnosed with COVID-19, 379 were under investigation and awaiting test results, and 146 needed to quarantine because they were close contacts of a person who had COVID-19. At the hotels, a team of nurses, health workers and security staff supervised by a physician provided free, around-the-clock support to guests, who were monitored for COVID-19 symptoms and were called twice a day for wellness checks. Those with alcohol or other substance use problems were offered consultations with addiction medicine specialists via telemedicine.